First things come first, so we'll talk about the simple root canal treatment.
Yes, if we talk about RCT, this is the actually bread and butter of dentistry.
So what are the indications and contraindications of implants? Who can get it done and who is not a fit candidate for it?
After an age of 15 years, anyone can get the implant.
So how safe are these implants? How many implants can one get it done in one go? Like,
If a specialist is doing an implant, so there are no limitations to the number of implants you can get it done.
okay doctor, now coming to the basic dentistry and the basic oral hygiene.
Actually, that is the important thing. मैं उसके साथ सबसे ज़्यादा focus करना चाहूँगा. Just few points. That's it.
Hi guys, welcome to Smile Talks with Dr. Anubhav, where we'll be taking a whole new perspective towards oral hygiene, decoding the trending treatments, and today we have with ourselves Dr. Anubhav Kesri, who is an accomplished maxillofacial prosthodontist and an oral implantologist, and he is the brainchild behind the dental crowns. And not to forget that he has an entire team of 9 specialist doctors working under the same roof. So welcome Dr. Anubhav.
Thanks, Dr. Trandeep. It's a pleasure being here, and to all these great listeners who will be over here listening us. And I hope I'll be giving a good experience about the dentistry, and the basics should be clear for all the listeners over here. Let's talk teeth, I would say.
Sure. First things come first, so we'll talk about the simple root canal treatment, which is a very basic treatment. So can you throw us some light and insights into how it has advanced over the years and how painful or painless this treatment is?
Yes, if we talk about RCT, this is the actually bread and butter of dentistry, and it has been started long back. So yes, definitely during the researches and everything, it has emerged a lot, and definitely I would say that it has been now you would say a painless treatment these days. It earlier it was the root canal generally used to be done in 4-5 sittings, but now if we talk about these days, if we have a good prognosis, very less infection, so I would say we can even do the root canal in a single sitting. For example, 45 minutes somewhere is the maximum time for doing a single sitting root canal for a single teeth, and everything is done under anesthesia. So yes, painful? No, I wouldn't say that it would be something painful you will be feeling. It will be totally painless, just the injection we will be pricking you, and I hope that will give you a good and actually better result than the earlier root canal that is being done. We have motorized things, we have all the AI assisted these days. We have introduced the AI assisted machines that help us doing the root canals very precisely in a very less time and very comfortable to the patient as well.
That sounds great, doctor. So now talking of the trending treatment, everybody wants that beautiful smile to flaunt it. So talking about the smile makeover, so can you throw us some light on this?
Sure. I would say thank you to all you guys, all the influencers over here, because these days we tend to see everything through all the small reels, all the influencers. They are actually helping us out in every way. So these days patients are coming to us, and they know what they actually want the treatment like. So that actually helps us कि what we can figure out, and we can make out कि what the actual treatment patient wants. They know the end result. So these days we have entered into digital dentistry. These digital dentistry actually helping us out, because how we can say that if you want a good smile and everything, we have very minimal preparation veneers, we have so aesthetic crowns, lifelike crowns, that no one even feel like we are having the crowns and everything. All these are being done in just 2 and 3 appointments. So these digital dentistry, these digital workflow is just letting you know all the treatment protocols. They will let you know what will be the final result, and actually that helps us and to the patients as well to know how they will be looking after or end of the result of the treatment. So earlier in these kind of treatments, we weren't able to show the patient how these how will be the result you will
end
be
result.
end result you will be getting. So we generally do it manually and everything. Now these digital workflows will just do a digital scanning, will get the smile makeup and everything done on a digital model. We discuss it with the patients and everything, and we can get every armamentarium according to the things that the patient wants, and we can do it very painlessly without any bleed and everything, without any pain. I guess that's the actual problem people face. People scare about the pain the dentist will give you. I would say these days the pain and everything will, we don't talk about pains. No, the dentistry is like actually painless if we have entered into digital dentistry or maybe with the advanced AI assisted things. So I would say no pain is there, just the very minimal injection pricking, and we are very precise these days. We know how much millimeter and even micromillimeter things we have to remove. So this is actually helping us and giving us a good result. And all these Bollywood actor actresses, Hollywood actor actresses, so all of them are getting these perfect smile. How do you know? So whenever you look at any of the actor actresses in a film and everything, they have a perfect smile.
Right.
None of them born with a perfect smile, definitely. But these days, that smile makeover is very easy, and doing it digitally has made it so perfect, so lifelike.
So basically, in this smile makeovers, it's the veneers that we are using, doctors.
Yes.
So can you tell us more about these veneers, that other than the smile makeovers, these veneers are helpful for other reasons as well. So can you share those reasons with the audience?
Yeah, sure. So actually what is happening, these veneers, these are basically very thin shells of ceramic. So what actually they does, they the problems actually, why do we need to go for a smile design? I would just discuss basic of that. So there are people have a crooked teeth, malaligned teeth, right? People have some kind of stains over the teeth. So over the year, these stains become so fixed on the teeth that we cannot remove it during the scaling and natural cleaning. So these thin lifelike veneers, what we do a very minimal and no minimal preparation over the front surface of the teeth. Front surface as in जो आपको दिखाई देता है during smiling and everything. और उसके ऊपर we just put that single layer of ceramic. We fix it. We have a glossy finish, and these veneers they actually pass the light through it, and it gives the natural appearance of your actual teeth. So you will just feel like that your teeth got straightened up, but no, actually we generally make it aligned, not through the movement of the teeth, but applying a single layer of. And now these I would talk about these veneers. They come with a good warranties and everything. So it's not like that you have get it done and it will be staying it for like 1 or 2 years. No, these may be a little costlier treatment, but definitely if we talk about the prognosis, it goes for good 15-20 years even. You have to maintain. That's it, nothing else. We always say visit your dentist in every 6 months. If you're getting all these kind of treatment, definitely these 6 months will help you. And this costlier treatment, if we pen down these treatment and cost it down in EMIs, then I would say it would hardly cost 100 rupee per month treatment. If you talk about for next 15 years, 20 years, this treatment lasts long. So these treatment will last so long. Sorry. So this is how these veneers are being used. There are other options for the smile makeovers as well. Now, if you have heard of aligners.
Aligners, yes.
So these aligners are also one of the option for smile makeover. If you have a crooked teeth only, but you have a good smile, you don't want to get your teeth touched, and you are at that age that you can't wear those braces and everything, then I would say aligners are actually one of the good options. So these aligners, they generally, if you are sitting at a distance of somewhere 5 feet, no one will even appreciate that we are wearing aligners. You just have to, remove it while eating. That's the only thing. And even I would say that will even give you a good weight loss as well in that case. So
Absolutely.
this is actually one of the good treatment modalities, advancement, and everything is now AI assisted. That's the best part. So you know what the result you are getting after the end of the treatment. So that's the important thing.
That sounds really good. So having that perfect smile is not that tough anymore. Now coming to another trending treatment, and I think that's your specialty as well, doctor, the implants. So can you throw light on implants, talking about how they are much better than the bridges and the crowns, the longevity of them and stuff like that?
Yes, so actually implants these days are very trending, and trending is a good word for people, but I would say that's actually very long lasting. That's one of the very good treatment, I would say. Earlier, if you want to have a fixed option for any kind of missing teeth, so those fixed options generally we used to give it with a bridge. Bridge is something like touching your adjacent teeth as well, and touching a very nice teeth without any, I would say no cavity in it, and everything is fine with it, but we are touching it just to give a replace to a missing teeth. So that is actually not justified.
Right.
But earlier these advancements were not there, so we generally used to do it. These days also we do it, because I would say if you have already some of the cavities or something on the adjacent teeth, then it's preferred to go for a bridge. Already we are giving crowns on those teeth, so we can give a bridge as well. But yes, implants has so much of advantages over bridges. If I pen down it, I would say first and the foremost that we do not have to touch any of your adjacent teeth, and that is actually most important. When you have a very good teeth and no cavity in it, why to touch it? Why to go for trimming of the teeth, reducing the structure and everything? No, we have a good bone height. We have removed the teeth. So what we can do with a very minimal surgery, malab surgery is just the thing that I'm using the word, but it's a very minimal procedure. We just give you anesthesia again. While removing teeth, we give anesthesia. While doing root canal, we give anesthesia. Even while doing implant, we give a single shot of anesthesia. And after that, within 15-20 minutes, single implant can be placed. So the time has been reduced with the advancements and everything, that I would say implant actually, yes, implants were, I would say, very tough thing during 20 days, 20 years back, if we talk about. But now these days again, we can do freehand implants, and even we have, guided implants these days. So if we talk about guided implants, so these guided implants, what we do, we get your impression done and everything, and we have a fixed guide that we get from the lab and everything. Again, this is all digital. This is a digital workflow.
Okay.
So what we do, we have specific size of implants. We have the specific size of drills and everything. So what we have, just put those guide over your adjacent teeth, and we can do a specific drilling, very particular, even bloodless, even stitches less, I would say. Not even stitches are required these days. We can do implants in a regular go-to procedure, getting implants done, and you can go to your office as well.
Oh, wow.
Now implants are that easy. You just have to have those medicines for next 2-3 days, that's it. And these guided implants have given a lot more to everyone, to old age patients. This is one of the good treatment modality for old age patients, because generally we see old age patients having many particular missing teeth. So we can even do full mouth implants and everything. And these days with the implant placement, we can give you right away the crowns as well. So for example, if you have some of the problem in your front teeth, right? So in that case, you just come to our clinic. We'll just do a scanning and everything. We can plan it, and maybe in the evening or maybe the next day, what we can do, we'll just remove your teeth. We can put implant, and even we can put that the teeth that we have removed, that teeth can be placed over the implant. So no one even other than you, no one even get to know that you have got a implant surgery done. So these days the implant is being so easy, so I would say painless and very less time consuming. So this is, I would say, one of the good treatment modality, and it has much more advantages over bridges.
So, what are the indications and contraindications of implants? Who can get it done, and who is not a fit candidate for it?
Yeah, so actually that is one of the conditions that generally my patient asks me. Uh, After a age of 15 years, anyone can get the implant.
Okay.
At the age of 90 as well. I have done a full mouth case of implants at a patient of the age somewhere 85. But yes, there are some of the contraindications that actually there are two categories of contraindication. One is the absolute and one is the relative. So absolute contraindication is very less. Uncontrolled diabetes is one of the option. Uncontrolled. This is actually one thing. Uncontrolled means you are having HbA1c level above 8 or 9 or 10 somewhere. If you have something like 7.57, we can do it. So this is a relative contraindication. So these contraindications relative are, there are some of the relative contraindications with high blood pressure, diabetes. You have something related to joint pains or something. So this is some of the things. But apart from this, I would say actually you can anyone can get the implant done. Your bone quality is generally good enough that you can get the implant done. For that we have again a 3D x-ray that is called as CBCT or a dental CT scan. So through that we can have a good idea and a treatment plan for your implant, implant sizing and everything. So that will give you a very predictive result. Apart from this, I would say no as such contraindication. Relative contraindications could be there. So if you control your diabetes, if you control your blood pressure, so yes, anyone can get the implant done. Yes, if you are going through some kind of heart problem, or you are under blood thinners, then with the recommendation or with the consult of your cardiologist, we can even do the implants on the heart patients as well. So no as such absolute contraindication is there, but yes, there are some things, some bleeding disorders and everything that we can deal with. So yes, we can do implants. Maybe if you have some underlying disease or comorbidities, we can say, so we can defer it for a week, 10 days, but we can do implants. So there is no contraindication. Yes, we can do it, and yes, get the implant done with proper planning. So CBCT CT scan that I'm talking about is a very good tool that will help your dentist to get the to do the implant with very small precision. So if you know that implant will go at around 10 millimeters of depth, definitely the implant will go at the depth of 10 millimeters only if you have done the CBCT and everything. So this is all digital dentistry these days that may have easier our work.
So, how safe are these implants? So, what are the chances of having some sort of disasters with it?
Yes. So I would say there are chances for the complications as well. Definitely, it is a kind of surgery, but the complications that generally comes with oral hygiene things and oral cavity things or oral implants, I would say there are very less and controllable. So the complications which go uncontrollable, that doesn't come with the implants. So with implants, you may have a little excessive bleeding that can be taken care of. Maybe with some sort of injections, we can deal with those bleedings. Yes, there are the things where you have swelling or something like that. In that case, we generally don't prefer doing implants at the same time. We generally ask the patient to get the teeth extracted, wait for another 4-5 months, then we can do the implants. So in that case, we can reduce down the complication chances. Complications can be there with everyone and anyone, because this is a kind of surgery. We are dealing with the live patients. So there are certain instructions that you have to follow up the implants that reduces your complications to 98%. Because if you follow all the instructions given by the dentist after the surgery, so they know what actually could happen with you. So they know, and accordingly they give you the instructions. There are very less chances, I would say 1% or 2% chances, that may lead to the failure of the implant. But that is also the thing, that you can remove the implant and you can do it again, maybe in a 4 5 good 6 months, or maybe a year later, but you can get it done again. So the complications are very calculative these days. So with following the good instructions, you can actually reduce the complications to 98%. And definitely, I would say, with the comorbidities and everything, so your dentist will pre-handedly tell you that you can get the implants or not. So this will reduce everything, I would say.
I'm very inquisitive to ask, like, how many implants can one get it done in one go? Like, you have to kind of wait to, you have to plan it. How do you plan? On what basis? What are the basis that you plan this surgery?
This is actually sort of the experience a dentist has, I would say. A specialist, if a specialist is doing an implant, so there are no limitations to the number of implants you can get it done.
At the same time?
At the same time, yes.
Yes.
We do a full mouth surgeries.
Okay.
Full mouth surgeries means you don't have a single teeth, and we will give you 12, 14 implants in a single go, in a single day surgery. There are some modified versions of the implants as well, that you must have heard something like getting a smile in 72 hours or something like that. So in those things, we even give 18 and 20 implants in a single go. Okay. So, and this is all done at the chair side. No hospitalization, can be done in a general local anesthesia. No general anesthesia is required. So this is actually more dependent on the expertise of your specialist, I would say. But the limitations, I actually will say that the limitations are not actually with the implants, but with the specialty, I would say. We have all the specialists under one roof. This is what we do. If we are going for a big surgery, we have everything planned. We have all the specialists available at our center for any kind of, urgent treatment. So we even, remove 10, 20 good teeth, and we do the implant at the same time, and can be done in a single day, maybe 6 hours. We can even split the treatment, giving a break of 1 or 2 hours in between.
Okay.
So that will even help you. Yes, you do not have to keep your mouth open. Actually, that's one of the thing that the patient will say, we have to open your mouth for 6 hours. No, I would say no. We can do it for 1 hour, 2 hours. We can give you a break of half an hour. Then we can start it. So we have everything simplified. Just the best treatment is the actual thing that you have to get it done.
Thank you so much, doctor. Okay, doctor, now coming to the basic dentistry and the basic oral hygiene. So how do you think, what are the steps as a parent one must take to ensure that the kids have good oral hygiene?
Yes, that is actually one of the neglected thing, I would say. Generally, parents have a tendency that my child just has a single teeth, or two or three teeth. Why do we go for a brushing thing? He or she doesn't eat anything. They are just on the milk. No, that's actually wrong thing. You should start visit. You should actually take your kid to the dentist once your kid is actually a 6 month old. That's the first time that your kid should visit to a dentist. Yes, he or she may not have any single teeth, but the dentist is not only related to the teeth. He may have a look at your gums, even the tongue and everything. Actually, when a kid's toddler, I would say, not the kids, will come to the kids section as well, kids part as well. If you talk about toddlers, they generally feed on milk, but your tongue, they absorb milk. So yes, they might have a bad breath. So yes, you have to start visiting to the dentist from the age of 6 months, and for the regular routine oral hygiene at your home, start cleaning the tongue and the gums of your kid from the 6 months. And I would say even you can start cleaning the tongue starting from the 3 months, but 6 months you should visit your dentist. You should start brushing the teeth once you see a single teeth, even a single teeth can catch the cavity with the milk that the that your child is drinking. So starting from 6 months, I would say, and you can start with a very minimal fluoride toothpaste. These days we have so many varieties of fluoride toothpaste these days. We have very less amount of fluoride, we have a good amount of fluoride, we have a medium amount of fluoride, and it all depends what your kid can use it. So yes, your dentist will tell you which kind of toothpaste you can use, and that will actually help reducing the cavity. Because these days I would tell you that these days I have so many kids patient in the clinic having a very minimal and going up to the maximum of 4, 5, 6 cavities all together in a single go.
Oh.
This is called as nursing bottle caries. So these nursing bottle caries actually caused with the milk that generally your child drinks with a bottle, feed to your mother and everything. So yes, we can reduce this thing. So you should start visiting to the dentist, I would say 6 months, and he or she will tell you, your dentist will tell you that which kind of toothpaste will help your kid to reduce the cavity and have a very beautiful and a good smile.
So talking of toothpaste, these days charcoal toothpaste is really trending. So can you tell us whether it's just an upcoming trend or it really has some benefits over your conventional fluoride toothpaste?
I would say actually these charcoal toothpaste is more of trending. This is some kind of medicated toothpaste. We also used to recommend these charcoal toothpaste earlier as well, but not the basic with the only the ingredient of charcoal. Actually, these charcoal toothpaste they are generally abrasive. So for long-term usage of charcoal toothpaste will give you a better result in the initial go, but in the long term, this will deteriorate and reduce the thickness and the enamel layer of your teeth. So yes, you can use it, but on the recommendation of the dentist. These charcoal toothpaste, generally the ad comes with a good white smile. These charcoal toothpaste will give you. Yes, I would say that's actually not a wrong thing, but you can get a good bright smile and a whiter teeth with the dentist as well, and with a minimal or no damage to your teeth. Actually, these charcoal toothpaste will remove your outer layer, that is enamel. It generally should be used for 3 weeks of the maximum time and may go up to 3 months, but definitely it would be suggested by a dentist, then only it is recommended, I would say.
So now talking of dental flossing, which is a very important aspect of our oral hygiene. And our dental flossing has also come of age from talking of, something like 10 years ago to what it has come to now. So can you throw some light on the latest trends of dental flossing?
I would say dental flossing is one of the neglected thing at your home practice. If we have a survey, I don't think more than 20% of the people, at least in India, are doing the flossing. If you talk to me as well, I would say it is tough earlier. Now with the advancements, we have a very good advantages, with the flossing over no flossing. So yes, it is one of the neglected thing. I would say if we take a survey, do a survey, and we check, at least in India, maximum 20% of the people must be doing flossing regularly. If you talk about me as well, 10 years down the line, yes, I was not even doing flossing. I knew that we have to do it. We have studied in my curriculum, and even since I've been practicing long back, and I have been recommending to the patients to do floss regularly, but even they don't do it. Even even after recommending, they don't do it. Actually, the main problem with the flossing is the manipulation. The doing flossing is not that easy. With the thread flossing that you must everyone know, that thread floss, doing it on your back teeth, it's really tough. So yes, with the advancements, we talk about a water flosser. Anyone who has visited to a dentist can relate that a dental chair has a three-way syringe that generally dentists use a spray or a water pressure on your teeth. So water flosser is just a portable version of that three-way syringe. Basically, it has a motorized box with a capacity of 300 400 ml of the water, and you have some good modes, 4 5 6 modes, and with that you can change the speed of the water flosser. And this will clean your teeth between to clean the surface between the junction of the two teeth. So that is actually very important. Generally, the cavity emerges from joint of the two teeth, from the surfaces that are joining. Generally, fibers of vegetables and even the non-veg foods generally get to tend to, I would say, stuck between your teeth, and the
Right.
back teeth especially. And if you don't have any floss, you cannot remove it. Your brush won't be able to remove that thing. So with the water flosser, that is very easy to use it, and it will hardly take 10-20 seconds. That will remove those fibers from your interdental area, and actually that will help to improve your oral hygiene. That will reduce your cavity, that will reduce your sensitivity, and give you a longevity.
So, doctor, can you give us a simple, comprehensive few steps with which we can maintain our everyday oral hygiene?
एक्चुअली दैट इज द इम्पोर्टेंट थिंग. मैं उसके साथ सबसे ज्यादा फोकस करना चाहूंगा. जस्ट फ्यू पॉइंट्स, दैट्स इट. मतलब बहुत इलेबोरेशन नहीं. क्या क्या चीजें इंपॉर्टेंट हैं, आपको अपने डेंटिस्ट के पास हर 6 महीने में विजिट करना चाहिए. यू शुड विजिट योर डेंटिस्ट इन एवरी 6 मंथ्स. 6 महीना एक काफी अच्छा टाइम होता है जिसमें आपके दांतों पे काफी ज्यादा प्लाक अक्यूमुलेशन या कैलकुलस डिपॉजिट हो सकता है. तो अगर आप देखेंगे, क्लीनिंग एक बहुत इंपॉर्टेंट एस्पेक्ट है डेंटल का. सो डेंटिस्ट्री में सबसे इंपॉर्टेंट, अगर आपने स्केलिंग, जिसे क्लीनिंग भी कहा जाता है, अगर आपने स्केलिंग रेगुलरली कराई है तो उसकी वजह से आपके दांत में जो कैविटीज, सेंसिटिविटी या फिर ब्लीडिंग गम्स, या बोल सकते हैं बैड ओडर, तो ऐसी सारी चीजों से आपको आराम मिल जाएगा. उसके लिए आपको हर 6 महीने में एक बार डॉक्टर के पास विजिट करना पड़ेगा. एक्चुअली ब्लीडिंग गम्स बहुत कॉमन रीजन है, बट उसके लिए लोग सोचते हैं कि किसी चीज की कमी, या कोई विटामिन की कमी, या किसी और वजह से, या कोई दांत कट गया, या किसी भी चीज की वजह से हो सकता है. ऐसा नहीं है. मोस्टली जो 99% कॉजेज ब्लीडिंग गम्स इज योर अंडरलाइंग प्लाक अक्यूमुलेशन. आप डेली ब्रश करते हो, बट क्या आप उसको 100% एफिशिएंसी से करते हो, ये आपको नहीं पता. तो उसके लिए अगर आप 6 महीने में एक डेंटिस्ट के पास विजिट करोगे तो वो आपको उसका ओवरऑल कॉम्प्रिहेंसिव चीज बता देगा कि क्या आपने क्लीनिंग की आपको जरूरत है, आपके दांतों में कोई छोटी कैविटी है. तो मैं आपको बताता हूँ, एक्चुअली डेंटिस्ट्री एक प्रिवेंटिव ट्रीटमेंट है. अगर आपने उसे प्रिवेंशन फेज में ही ठीक कर दिया तो मुझे लगता है कि आप कॉस्टली ट्रीटमेंट से बच सकते हो. आप 90% ऑफ डेंटल विजिट्स कम हो सकती हैं. सिर्फ 10% ऐसी चीजें हो सकती हैं जो अनअवॉइडेबल है, जो आपके हाथ में भी नहीं है, आप रेगुलर ओरल हाइजीन मेंटेन करके भी नहीं मैनेज कर सकते. वो एक अलग चीज है, उस एस्पेक्ट को हम छोड़ सकते हैं, बट आप 90% अपनी चीजों को कम कर सकते हो. सो द निग्लेक्ट ऑफ अ डेंटिस्ट्री इज लाइक कि उसकी वजह से आपके विजिट्स बढ़ जाते हैं. फिर आप डेंटिस्ट के पास जाते हो तो एक नहीं 10 और परेशानी निकल के आती है. उसको रोकने के लिए प्लीज आई वुड सजेस्ट गो टू अ डेंटिस्ट इन एवरी 6 मंथ्स. सबके पास आई गेस डेंटिस्ट इज रेडिली अवेलेबल. मुझे लगता है कि ऐसा नहीं है कि डिवॉइड है डेंटिस्ट्री. यहाँ पे इंडिया में डेंटिस्ट बहुत हैं. एक उनके विजिट के साथ आई वुड से आप अपने ओरल हाइजीन को मेंटेन कर सकते हो, और आप अपनी बड़ी प्रॉब्लम को छोटा भी कर सकते हो, ट्रीटमेंट को वेरी वेरी मिनिमली एक्सपेंसिव में भी रिमूव कर सकते हो. ये चीज है.
Thank you so much, Dr. Anubhav. I hope our audience has gained the deep insights from this entire conversation, and we have deep dived into the world of dentistry. So if you like this episode and took back home some of the pointers which are going to help you in your oral hygiene, so please subscribe to my channel and also like, comment and share. Thank you.